The broadcast is now starting. All attendees are in listen-only mode.
All right, we're going to go ahead and get started. Good evening, everyone, and welcome to tonight's webinar for Patient Care Project Vice Presidents and Chairs. My name is Josh, and I'm currently one of your APhA ASP National Members at Large. I'm a final year student pharmacist up in Buffalo, New York at UVille College, and I'm really excited to talk to you guys tonight because I was actually a Patient Care Project Chair myself between my first and second year as a student pharmacist. I am also joined tonight by Crystal Atwell, Director of Student Development at the American Pharmacists Association, and Sarah Wettergreen, Vice Chair of the APhA ASP Education Standing Committee. Just a bit of housekeeping before we go ahead and get started. If you'd like to use your telephone during this webinar, you'll go ahead and dial in using the number listed in your email that you received and enter the access code followed by the audio PIN. Or if you would prefer to use your computer, you can continue doing what you're doing and use the mic and speakers. Everyone is currently on mute, but if you would like to ask a question during the presentation, you'll click on the raised hand icon. And I would like to encourage you to ask questions throughout. We do have a moderator who will try to answer those during the presentation. You can type the question on the right side of your screen and we will answer those, like I said, throughout or at the end during the Q&A session. So tonight we're going to go over some of the responsibilities of your position, each of APhA ASP's patient care projects, as well as the reporting and awards. So part of your responsibility as the chair or vice president of patient care projects is to inspire your fellow student pharmacists to become involved. Simon Sinek is an author who is best known for popularizing the concept of the golden circle, a simple but powerful model of inspirational leadership. Sinek says that all great and inspiring leaders think, act, and communicate the exact same way. It's a pattern, and it's the complete opposite of what everyone else does. Why, how, what? Most people know what they do. Some know how they do it, but very few people know why they do what they do. Apple is a good example because everybody gets it. If Apple were like everyone else, a marketing message from them might sound like this. We make great computers. They're beautifully designed, simple to use, and user-friendly. Do you want to buy one? But Apple doesn't do that. This is how Apple actually communicates. Everything we do, we believe in challenging the status quo. We believe in thinking differently. The way we challenge the status quo is by making our products beautifully designed, simple to use, and user-friendly. We just happen to make great computers. Do you want to buy one? And I think I have the perfect example to share with you guys from Apple's Think Different campaign of the 90s. Here's to the crazy ones, the misfits, the rebels, the troublemakers, the round pegs and the square holes, the ones who see things differently. They're not fond of rules. You can quote them, disagree with them, glorify or vilify them. But the only thing you can't do is ignore them because they change things. They push the human race forward. And while some may see them as the crazy ones, we see genius. Because the ones who are crazy enough to think that they can change the world are the ones who do. Now you probably don't think that that's a commercial for a computer company. But it's the reason that we're completely comfortable buying a computer from Apple. It's also the reason that we're comfortable buying an MP3 player, or a phone, or a DVR, or a TV, or whatever it is that Apple is selling. But they're just a computer company, right? Apple isn't any more qualified than their competitors to make these products, are they? I mean, most people can't even imagine buying an MP3 player from Dell or IBM. Why would anybody buy an MP3 player from a computer company? But we do it every day because people don't buy what you do, they buy why you do it. Apple is a company that believes in what they do so much that it's changed the way people think about them altogether. Our Academies theme this year is Be the Change, a philosophy that you can integrate into your patient care projects. It's a way of thinking that can help you inspire your fellow student pharmacists. And although you won't be selling phones or computers unless you guys are running some amazing fundraiser that I've never heard of, you are selling patient care projects. So how can you get people on board? The best way to do that is by figuring out what your chapter is interested in. Remember, it's not a requirement to participate in each project, and probably the best piece of advice that I was given as a patient care project chair was to pick one patient care project first and to do it really well. Also, try to take some time to think about the needs of your community. Are there any unique or underserved populations that you might be able to focus on and help? Great patient care projects don't necessarily require a lot of money, but you should be conscious of funding when you're carrying out a project. There are also some legal considerations. Are student pharmacists in your state allowed to immunize? Can they conduct blood glucose screenings? These are some things that you're going to want to work with your chapter advisor or consult your state board of pharmacy to make sure that you're acting within legal parameters throughout the year. One challenge that you might face as a chair or as the vice president is designing a committee structure that works for you. Whether you're starting from scratch or building on tradition, there are a couple of tenets that I'd like to suggest that you can use to make a patient care project successful. Recruiting is key. Whether you have an entire committee or a dedicated individual, have someone seek the support of local pharmacists and get student pharmacists from your chapter on board. Another great tool to utilize is your new practitioner mentor. They have a whole network of friends that are also pharmacists that you can fall back on. These persons who are going to help you with recruiting can also provide information and training sessions for your volunteers. Advertising is also important. This piece of the puzzle is really all about communicating, and whether you're doing that through social media or printed promotional materials, I want to encourage you to play to your strengths. If you have a chapter member who is artistically talented or someone who is just a social media expert, see if they can help you out with your project throughout the year. Next is logistics, and this is really all about follow-through. It's following through on that plan that you're going to put in place. This committee or individual could help you determine locations for events and arrange for equipment that you'll need. They're really the glue for your project, consulting with other committees or individuals to finalize dates, make sure you have those pamphlets that you were hoping to hand out, and remind volunteers to dress properly, whether that's in white coats and professional attire for a blood pressure screening or casual clothes for a high school presentation. I can't stress enough the importance of documentation. This is basically keeping track of what you've done throughout the year, so when it comes time for you to write your report, you're not scrambling at the last minute. I also think it's important to point out sending thank you letters will help you establish a great relationship so that you can continue to go back for your patient care events. We've all heard before that one size doesn't fit all, and the same applies for creating a committee. It's going to be up to you guys to figure out what works for you and what lets your committees function most efficiently. And again, these have only been suggestions of different tenets that you can try to follow throughout the year. So without further ado, let's talk about the patient care projects themselves. And up first is Operation Immunization, which was created to increase access to immunizations and promote public health. But it isn't all about vaccinating individuals. Through Operation Immunization, we are also able to collaborate with pharmacists and other healthcare providers, especially in states where student pharmacists are not able to immunize, to educate the public on what pharmacists are able to do. If you're looking for ways to incorporate the International Pharmaceutical Students Federation into your patient care projects, maybe you could focus an event on travel vaccinations and global health and team it up with Operation Immunization. Next, let's talk about Operation Diabetes. Operation Diabetes was created to confront the growing epidemic that is diabetes. This patient care project allows us to screen patients and collaborate with other healthcare providers while educating our communities about the importance of both prevention and secondary complications related to diabetes. This is definitely a time where you're going to want to refer to your state laws and talk to maybe your law professor or some faculty members at your school or college of pharmacy. In states where student pharmacists are allowed to participate in point-of-care testing, blood glucose screenings at local pharmacies or maybe your school or college of pharmacy, that's a great way to implement Operation Diabetes. On the flip side, if you're in a state where you're unable to do so, it's a good opportunity to educate members of your community on the risks and the complications of diabetes, and also to promote those healthy lifestyle choices that we all learn about in school. One way that you can tie IPSF and Operation Diabetes together could be to organize a diversity lunch or a cultural dinner where chapter members can bring an ethnic dish to share and discuss its nutritional value, whether it's positive or negative. Operation Heart is all about raising the public awareness of cardiovascular disease and its risk factors. What I think is cool about Operation Heart is that it provides a platform for student pharmacists to educate their communities about some of those catchphrase disease states that we all learn about, like hypertension and dyslipidemia. It also allows us to discuss tobacco cessation as well as diet and lifestyle modifications with our patients. I'm very pleased to announce that Walgreens is our new supporter of Operation Heart. And with that being said, Walgreens has opened their doors as a venue for your patient care events. So keep that in mind when you're planning this year. If you're focusing on Operation Heart, team up with other healthcare students on your campus and take advantage of the presence of maybe a nursing school or whatever it may be on your campus. Operation Heart allows first-year student pharmacists to practice their blood pressure screening skills, but it's also a really good chance for anybody to improve on patient communication. IPSF does have its own tobacco alert campaign, and the Great American Smokeout this year is on November 21st. So keep those dates and that other patient care project through IPSF in mind as you move forward with Operation Heart. Operation Self-Care was formerly known as the Heartburn Awareness Challenge, and it was designed to enhance student pharmacists' clinical knowledge and improve patient communication. Although we do have the expanded scope, we're still deeply rooted in improving that clinical knowledge and, again, improving patient communication. But the expanded scope of this patient care project allows us to be innovative and push Operation Self-Care down different avenues that it hasn't been before. So whether it's cough and cold, seasonal allergies, sun protection, or GI relief, we want to see you guys get creative. If I could be a first-year student pharmacist again, I think I would probably want to be involved in Operation Self-Care so that I could learn a little bit more about OTC medications, how to use them effectively, and especially how to read labels, which is another big component of Operation Self-Care. We want you guys to get out there and teach members of your community what those crazy labels mean and what everything that they say, how they can take that and use it effectively. Last but certainly not least on the patient care projects is my personal favorite, Generation RX, a community outreach initiative aimed at addressing the growing trend of prescription misuse and abuse. The best thing about Generation RX, in my opinion, is that there are a ton of resources ready for your use. We have toolkits, presentations, brochures, everything that you need to get this program up and running. And each of those is tailored to a specific age group that you can work with. I would also like to mention that we are anticipating the release of the Healthcare Provider Toolkit this coming fall, so stay tuned for that. As you can see here, we've also unveiled the new logo for Generation RX, which matches our other patient care projects a little bit better, and that will also be made available, as are all of our other resources at pharmacists.com. Generation RX as a whole emphasizes the role of student pharmacists as educators. So it's important to make sure your student pharmacists have been well trained and are comfortable before each of your events. It's also a unique chance to team up with other providers and local law enforcement agents for events like the upcoming Take Back Day in October. Lastly, I would like to point out that the top 3 winning chapters from around the country will have the opportunity to attend the University of Utah School on Alcoholism and Other Drug Dependencies, which takes place every June in Salt Lake City, Utah. And that's where they're going to get to share their secrets as to what's made them successful over the course of the last year. So now I want to direct your attention to Pharmacists.com, and I have a screenshot for you here of the homepage. And so this is where you're going to go to get all of your information about our patient care projects. You would hover over the Get Involved tab up the top there, and that's going to give you a drop-down menu. You'll be able to select APhA ASP, which will bring you to the next screen. And this is the home page for everything that is APhA ASP. So for you guys, the vice presidents of patient care projects or the chairpersons of patient care projects, you're going to click on APhA ASP Projects and Programs. That will direct you to this next screen, and as you can see here, you're going to hover over and click on whichever patient care project you're interested in learning a little bit more about. And once you do that, you're going to come to the home page for that specific patient care project. And if you look around on that page, you're going to find our planning guides. And our planning guides are really everything you need to know to get a patient care project up and running or to fine-tune what you already have. Most of them are pretty long, and there's a ton of information inside of them. Operation Immunization, for instance, is one of our older patient care projects, and I think it's close to 90 pages long. So if this is something that you're looking for more information on, Operation Immunization specifically, there's a ton of information within the planning guides. At this point, I would like to turn it over to Sarah Wettergreen, the Vice Chair of the APhA ASP Education Standing Committee, to give you guys an update on what's been going on with the Education Standing Committee and what updates have been made to the planning guides.
Hey everyone, my name is Sarah, and like Josh said, I am Vice Chair of the Education Standing Committee this year. One of the major focuses of the Education Standing Committee are the patient care projects, and something all of us are really passionate about, and we've been working to update and provide better resources for you guys. So what we've been doing lately is updating the planning guides. So we went through all the planning guides and made sure all the information is the most up to date. And then we've been adding some new materials. So now you'll see in the Generation RX resource, there are now public relations resources. So we have some sample PSAs and letters to the editor for you guys to use. And then we also have some new programming ideas for Operation Self-Care. Since that's a newer project, I know it's hard to come up with those new ideas and get new projects rolling, so we came up with some ideas for you as kind of a leaping off point. You can take those ideas and kind of make them your own. So just on that same note, if there are any resources that you feel would be helpful to you or your chapter needs, please feel free to reach out to me. My email is there if there's anything specific you'd like from us. And then I just want to encourage you to look at the patient care planning guides. My first kind of big experience in APhA ASP was serving as a chair of Operation Immunization. And I know I looked at the planning guides way too late to implement all the great ideas in there. So I definitely encourage you all to go check those out, start planning your ideas for the year, and get rolling. I look forward to seeing all the things that you all accomplish. Thanks.
Great, thank you for the update, Sarah. And I would also like to point out that you can expect the updated planning guides to be posted next week, again on Pharmacists.com, and you will follow those same steps that I just went through with you to find those. So next, I want to briefly go through some of the reporting and awards that you're going to be dealing with closer to the end of the year. So for Generation RX, we're going to start with this one because it's a little bit different than our other patient care projects. So the reporting cycle for Generation RX is January 1st through December 31st, and the report deadline itself is January 5th. The 8 regional winners will be recognized on stage at the APhA annual meeting and exposition, which is in Orlando, Florida this year. And the top 3 winning chapters will also be recognized on stage. And the top 3 chapters will have the opportunity to send 2 representatives to the University of Utah School on Alcoholism and Other Drug Dependencies, which is again in June, like I mentioned before. And then I'll go ahead and talk about the other patient care projects. So each of our other 4 patient care projects, the reporting cycle is June 1st through May 31st. And the report deadline, just like the chapter achievement reports, is July 15th. A little bit different here, the 8 regional winners will be recognized on their home turf at their respective mid-year regional meetings, which I would like to point out that MRMs are a great resource for you guys to go and meet up with other chairpersons or vice presidents of patient care throughout your region and share some of those ideas when you're a little bit closer to home. The annual meeting and exposition, we have tons of workshops and more information about the patient care project. So if you can make it out to MRM and the annual meeting, I would absolutely encourage you to do so. For each of our 4 patient care projects, 1 national winner will be recognized on stage, just like Generation RX, at the APhA annual meeting and exposition, again in Orlando, Florida. So what does it take to bring an award home? Each of the awards criteria for every one of our patient care projects is listed in the project planning guides. And I know that this has been confusing in the past, so take a second to jot that down. If you're looking for the awards criteria, it's going to be in the planning guides, which again can be found on Pharmacists.com. Each of the patient care projects considers collaboration. So who have you collaborated with? What other organizations? Or maybe it's another chapter of APhA ASP that's close to you. Participation. So how many student pharmacists, college or school of pharmacy faculty and staff have been involved? And how many other additional pharmacists were you able to bring on board? And again, that ties back to the recruiting aspect that I mentioned before. Next is originality. So how creative, how innovative, how original were your projects and programs? And lastly, what was the outcome? What effect did your project have in your community? How many patients did you screen, and how many people were able to be educated through your project? And I would like to emphasize that it's not always quantity. We do consider it's as much as it is about how many people you're hitting, it's really about the quality of the project that you're putting forward. So I'd like to take a moment to recap some of the things that we've been through so far. Great leaders think differently, and they inspire action. They communicate from the inside out, and they know why it is they do what they do. I'd like to encourage you to figure out a committee structure that works for you. And we went through some of those tenets before, so recruiting, advertising, logistics, and documentation. But it's going to be up to you guys to figure out what works best for your chapter and how you function most efficiently. I'd like to encourage you to find innovative ways to exemplify our Academies theme this year. Show us how you can be the change in your community through your patient care projects. And finally, utilize Pharmacists.com and our planning guides, which we've talked about a couple of different times now. They're your best resource. There's everything you need to know about our patient care projects found right on Pharmacists.com in each of their respective patient care project planning guides. I would also like to encourage you guys to reach out to your regional members at large. I know that Sarah and I have both given you some tips tonight, and all of our contact information will be listed at the end. But also take the time to contact your regional members at large. They're experts as well, and they know what's going on more specifically in your particular region. And so they might be able to connect you to another school or college of pharmacy that's close to you that has some great ideas and ways that you could improve your patient care projects. At this time, I would like to open it up to any questions that may have been typed or anyone who would like to ask any questions.
All right, thank you, Josh. Good evening, everyone. As Josh mentioned, I am Crystal Atwell, and I serve as the Director of Student Development for APhA. So go ahead and begin typing in your questions, or as Josh mentioned at the beginning of the webinar, if you're in an area where you can talk feel free to use the raise your hand function and I will come unmute you and you'll have an opportunity to get your questions answered. So our first question, Josh, is will a copy of this presentation be available afterwards?
Yeah, that's a great question. So this presentation has been recorded and it will be posted on APHA ASP's YouTube channel, so you can absolutely find it there and hear a little bit more about what we did discuss, because I know that not everything that we have mentioned has been listed in this presentation. So absolutely keep your eyes peeled on our YouTube channel for APHA ASP and you can find a copy of this presentation available.
All right, great. And our next question is, how do individuals find the contact information for their regional members at large?
Yeah, that's another great question. So all of the regional officers, their contact information is listed on pharmacists.com. If you go to pharmacists.com, you're going to follow the same steps. You'll hover over Get Involved and click on APHA ASP. From there, you'll click on Leadership Opportunities, and you'll scroll down to the bottom where you will see a link for regional officers. And you can follow that link to find the contact information listed for your particular region.
Okay, our next question is referencing committee structure. So when choosing your committee, does it have to be chapter members or can it be any other members that are interested in participating?
Could you repeat the question, Crystal?
Sure. So when you are choosing individuals or having them sign up to be members of your patient care committee, do those individuals have to be chapter members or can they be from other classes and just interested in participating?
Yeah, I would absolutely suggest that they be chapter members. I think that it's fair to have anyone be involved, but really our patient care projects, if you could get chapter members involved, I think it's going to have the most weight for them. They'll get the most experience out of it as well. So if you could encourage chapter members to be on your committee or a part of your patient care project, I think that that would be great.
And I would just add on to what Josh is saying. You know, there's a lot of resources and a lot of benefits that come from participating in the patient care project. So use that to your advantage when it comes to member recruitment. You may consider keeping the first couple events open so that anybody can come and participate, or maybe making the training session open for the first one, and then moving forward, then it becomes a closed event that only your members can participate in. You really want to reward those people who've made that commitment and are interested in joining. Now that being said, if you're collaborating with another organization and they're a member of that organization, then it's perfectly fine for them to go ahead and participate. But just think strategically about how you want to really capitalize on participation in these projects as a membership benefit. So our next question is one I know you're going to like, Josh. What are some of the unique ideas that have been used within the Generation RX program?
Yeah, this is a great question. I love it. It's my favorite. So I think you're looking at one of them. In my own experience, our chapter was pretty adept with using Prezi, and that's the software that I've used to create this webinar for you guys tonight. It's a really great innovative platform for you to convey some of the information that you might traditionally use PowerPoint for. And in my own experience, it kept our audience members intrigued and just attentive throughout the presentation. And so I think that this is something that you could consider. Prezi is pretty easy to use. You can have a free subscription, or you can subscribe for a yearly fee that's not too steep, and I would encourage you to take a look at that. But there are a lot of other ways that you can be innovative as well. I know that chapters in the past have created YouTube videos to convey their message. Another great resource that's available through pharmacists.com is there are skits that are available for different age groups. So whether you're trying to target a collegiate audience or maybe it's middle school students, like I said, that healthcare provider toolkit is coming out soon. The cool thing about Generation RX is that it's still pretty new, and there are still a bunch of new ideas that are coming forward. So check out what there is on pharmacists.com, but I would absolutely encourage you to use maybe Prezi or a different platform to convey your message. And never settle. Always look for something new and fresh.
All right, so along those same lines, if you could maybe touch on one or two creative ideas regarding the other patient care projects. And I'll actually go ahead and, Sarah, I'm going to unmute you so you can jump in as well with some of those more creative ideas when it comes to the other patient care projects as well. So Josh, you want to go ahead?
Yeah, absolutely. So I touched on one of the creative ideas for Operation Diabetes and sort of meshing Operation Diabetes with IPSF. I think a really great idea would be a cultural diversity lunch or maybe some sort of an ethnic dinner where different members of your chapter would be welcome to bring a dish to pass, and they would be able to maybe look up some of the nutritional information prior to coming. And so when they get there, they can share that dish that represents their culture, and they can also discuss some of the nutritional benefit, whether it be positive or negative, so that you can sort of tie an international perspective in with Operation Diabetes. And I know that there have been chapters in the past who have done this, and it's worked out really well for them. It's been successful, and I think that's pretty unique for a patient care project event. So I would say that that's something to consider for Operation Diabetes.
One of the more creative things that I saw last year, I reviewed the Operation Immunization reports, and there were a couple different chapters that kind of targeted children more in the flu prevention sense. So instead of going for the flu shot sense, they more went towards prevention. So they went into elementary schools and got the Glow Germ hand gel and brought a black light. And if any of you have ever done this, when you use the black light, it shows how much of the gunk you got off by washing your hands. So another way to reinforce good hand washing techniques and how that's important in preventing spread of the flu virus. And then some other things, self-care, one of the new focus areas is sunscreen and sun protection. So you could go to either a 5K or a local fair or something like that and provide sunscreen education and possibly free samples if you're able to acquire those. That would be something that would be new and a little bit different.
I think when it comes to creativity for your projects, you really want to first decide who your target population is and let some of your creativity come from them. You also want to think, how can I really make a lasting impression after the project has ended? So some of our chapters have really tapped into using social media and online resources, things that they've put together that then people that have participated in those health fairs can really go back and then use that information afterwards. You know, when you're participating in a quick event like that, it's hard to retain that information. So that's another kind of creative thing that people have been doing to utilize the technology that's out there as well. So we're going to move on then to our next question. And that question is, are there any patient handouts or brochures that APHA provides that we can use in our patient care events? And so I'll go ahead and answer this one. We don't have any pre-printed information for you that you can order from APHA. And the reason for that is that there's already so much great stuff out there. We don't want to reinvent the wheel. So what you're going to want to do is refer to the resource section of those patient care planning guides. And when you get into there, we're going to point you to websites like the CDC, the American Heart Association, and all of those organizations really have great resources that are available. A lot of them are already made with health literacy in mind as well, and so that's another benefit and reason that we've pointed you in the direction of those organizations. So definitely utilize the resource section in the patient care planning guide for that. And a question to follow up to this related to the planning guides is that, are the current guides on pharmacists.com or should people wait until the more updated version comes? So Josh mentioned earlier that the updated version is going to be coming next week, but I would encourage you to go ahead and take a look at the current guides. You can familiarize yourself with the layout of those planning guides. You can also kind of get a feel for the different sections that are in there. There's not a whole lot that changes from year to year. But there are some updates that are going to be happening, and probably the planning guide with the most significant updates, as Sarah mentioned, is going to be that Operation Self-Care one. So go ahead and get a feel for those planning guides. It'll give you some direction, and then once the updated ones get posted, you can be on the lookout for those changes. And the nice part about the planning guides being online is that you can share them with all of your committee members, chairs, and any faculty members also that might need to utilize those planning guides. All right, so moving into our next question, and Josh, I'll let you weigh in on this one. Do we have any resources where schools can submit the materials that they've developed and are willing to share with other chapters? This individual writes, I know that development time can be consuming, and it would be nice to be able to share resources in between schools. So Josh, what are your thoughts on sharing resources?
Yeah, I think that's a great question. I think probably your best resource to sharing ideas is going to be at your mid-year regional meeting. And I know that's a little bit ways off in October and in November for some regions, but even a Facebook group, and I know you could probably contact your chapter president, there are still some regional Facebook groups that chapter presidents are able to communicate through, and so if there are some great ideas that are lingering out there, you could probably find them a bit sooner if you're able to network and even talk to maybe your representative who may have attended the APHA Summer Leadership Institute. I know we did talk a little bit about the patient care projects there, so maybe they've made a great contact at another chapter in your area that could share some ideas. But I would absolutely say try to attend the mid-year regional meeting. It's a great way to connect to those other vice presidents of patient care and the chairpersons for each of the patient care projects a little bit sooner than the annual meeting and exposition, where we have those workshops that will help you become a better patient care project chair or a vice president of patient care.
And if you really have something that you're willing to share or want to get out there, for example, I'll use a resource that University of Arkansas last year really wanted to get out for the region. They mentioned it during their MRM. They contacted us and we kind of worked together to get it out to the region. So contacting us, we can help you through that process. Also, again, working with those regional officers, that's another great way to share. And again, we encourage that collaboration.
Yeah, I would just add, Crystal, that I think one of my favorite parts about being on your National Executive Committee, guys, is that I get to hear some of those cool ideas that you're up to, and we are able to spread some of those for you. So I know that there's a great idea that's come from the University of Iowa that they do sort of a week-long what it's like in the life of a diabetic, and whether it's, you know, watching what you eat and making a log of that all week and going in and getting, you know, mock insulin shots. Those are ideas that we've been able to pass through regional officers and national officers. So definitely contact us and let us know what you guys have going on and if there's some cool ideas that you'd like to share.
Okay, our next question is a common one, and it is one of the biggest troubles we have is getting pharmacists involved with our projects. So what recommendations do you have for getting pharmacists, and I would even extend this then to student pharmacists, involved in the patient care projects?
Yeah, I think that's a great question, and I would tie it back to that kind of recruiting idea that I brought up. I know for myself, one thing that we tried to do was just to get anyone that's on your committee, you know, if they work outside of pharmacy school, if they're able to talk to a couple of the pharmacists that they work with and just, again, express why it is you do what you do, whether you're really looking to apply some of that knowledge that you've learned in the classroom or make a big impact on your community. I think that there are ways that you can really convey to the pharmacist that this is something that we're all really passionate about and we would love for you to be involved. And I would absolutely say if you are able to get them involved, use some positive reinforcement. You know, write a thank you letter to them for being involved. Bake them cookies. Do something that's going to be worthwhile to them to show that you have realized that they've added value to your patient care project.
I think something else to think about is that for anybody, whether you're a first or final year, if you've never participated in something, it can be intimidating. So this might be a great opportunity to partner some of your more seasoned chapter members with someone who is a first-timer. And maybe it's just that the first-timer shadowing them so that they can kind of see and get a feel for what that event is going to be like. And remember to utilize that strength of your membership. It doesn't just have to be that you're actually taking the blood pressure or that you're testing someone's blood sugar. You definitely need people there who are taking pictures at your event so that you can document it, what happened, so that you can utilize those for your reports and your slideshows and all those other fun ways that you use those. Getting somebody that's going to just be there to help clean up, set up, those are all important activities. And I think it takes away some of that intimidation, and it also makes it easier for people to get involved when it's just that short-term, easy commitment and it's very specific. So try to utilize some of those strategies when you are looking to recruit. Our next question is related to our new partnership with Walgreens, and we're very excited to have them come on board. So if you are looking to go into Walgreens, the question is, do you contact any local Walgreens to set up the program, or is there a designated APHA Walgreens representative? We are going to be able to provide to you from Walgreens a list of key contacts within each area for the schools and colleges of pharmacy. So in your local area, there is going to be a Walgreens representative who's going to be designated as your contact. They're going to be able to help you get set up. They may point you in the direction of one store or another, or you can probably approach them if there's a certain location that you're going to. Maybe it's in an underserved area within your community and you'd really like to provide services there. So we're going to be providing that information for you. Walgreens is currently working on getting that list of information together, so be on the lookout for that. Now that being said, I do just want to make sure that everybody understands Walgreens is the supporter for Operation Heart, but that doesn't mean that you can't go in and do your Operation Immunization events at Walgreens, and it also doesn't mean that you only have to go to Walgreens to perform your Operation Heart activities. You can go to any community venue, any pharmacy, any school, so long as you are following your state guidelines, so long as you're following the practice guidelines that you need to be, and it's faculty approved. So just want to make sure that that's clear for everybody as we're moving forward. So our next question is screening for heartburn and Operation Self-Care related. So the question is, screening for diabetes and blood pressure is a bit straightforward because we have devices that can measure each of these diseases. How would you advise going about screening for heartburn as a part of Operation Self-Care? Josh, you want to take a stab at that one?
Yeah, absolutely. So I think that you can tie it back to the education component, and if you're screening for heartburn, I know one suggestion that I would make is take advantage of things that are in your area. So like I said before, I'm from Buffalo, New York, and we have a local national Buffalo Chicken Wing Festival kind of thing. And so I think that one thing that's cool that we're able to kind of do, because it's unique to our area, is we're able to go and do sort of an assessment, whether it's in the form of a short handout that people can fill out and get back to us about heartburn, maybe some of the symptoms that you might be experiencing that could suggest heartburn. Take advantage of things that are in your area and try to be creative and tie your patient care project to some of those events.
And I would add into that, specifically for heartburn, there are some screening materials available. You're going to be asking questions like, how many times a week or a month do you have heartburn? What foods have you noticed that trigger your heartburn? So there is a somewhat of a screening tool that you can utilize for heartburn, but keep in mind for Operation Self-Care and for all of the events, it's not just necessarily about the screenings, but also the education. So something that you can use are different quiz formats. A lot of our chapters have incorporated trivia into their projects to test participants' knowledge about the medication or disease state that they're talking about. And that helps people learn. You know that you don't want information just given to you, and it's more fun when things are interactive. So doing those types of trivia games is a great way to help reinforce the knowledge or teach people new skills as you're going through, and that education is just as valuable as the screenings that we're able to provide. So that's a great question. Our next question is, does ASP have any resources about appropriate antibiotic use? I'd like to incorporate that into a Generation RX event for collegiates. And I think this is kind of a twofold question. Generation RX is all about prescription drug abuse and preventing the misuse of those medications. For antibiotic use, this is definitely something that we want to make sure that people are using those antibiotics appropriately. and that they understand how they're supposed to take them. I've actually seen chapters incorporate appropriate antibiotic use in with Operation Immunization. Cough, cold, allergy, certainly it could be a part of your Operation Self-Care, and knowing when to refer patients versus when it's going to be something that you can treat over the counter. So there's a couple of different ways that that could potentially play in. We don't have any specific resources at this time that we provide, but there's definitely a lot of information out there available on appropriate antibiotic use. All right, Josh, our next question is, do you recommend different chairs doing different events together?
Yeah, that's a great question, and I would say absolutely. I think maybe one of the coolest parts about APHA ASP is that we do have such a variety, but there's also a lot of opportunities for you to team up and do events together. So like Crystal mentioned before, Walgreens being the new supporter of Operation Heart, that doesn't mean that you only are allowed to do Operation Heart events at Walgreens. So perhaps you're able to set up an Operation Heart event. Maybe you could also tie in a component with Generation RX, and you could counsel patients that are coming in and picking up prescriptions at Walgreens, what they can do with those prescriptions once they're finished with them so that they're not laying around the medicine cabinet. So I would say definitely try to team up and coordinate that through your own chapter to see if there are different ways that your individual patient care projects can work with one another.
All right. Our next question is, would you encourage student pharmacists to first be introduced to specific disease states before they begin implementing their patient care projects? So for example, you first need to learn about cardio disease before you implement Operation Heart.
Yeah, I think it's a great question, and it's not necessary for you to completely understand it. The planning guides are great because they do have a lot of background information. I think from the perspective of an old patient care project chair, I would definitely take a little bit of time to maybe go through it on your own and understand some of the finer details, because regardless of if you're a first-year student pharmacist or a final-year student pharmacist, you're immediately the expert for members of your chapter. So take some time and go through those planning guides. There is a lot of really great background information on some of those disease states, but it is possible for you to be a first-year student pharmacist or otherwise that maybe hasn't learned about that particular disease state and to still be involved in the patient care project itself.
I would agree. This is where also you want to utilize your faculty. Definitely whatever you're going out into the community to do, and whether that's just basic exercise coaching and helping people understand how eating right and exercise help keep you healthy. That's, pretty basic information, and it's mostly about communication and, fun activities. From that all the way up to doing cholesterol screenings and helping people understand what that number means. No matter what it is, you want to make sure that everybody's trained appropriately and that your faculty have been involved as a part of that training. The great part about the projects is that you can mold them to whatever year your student pharmacist might be, but you do just want to make sure that everybody's going out with the best information they can. So get your faculty involved and get your new practitioners involved, and that'll help everybody go out and really make your projects a success. Okay, our next question. If we use other organizations' handouts, do we have to reword them, or can we use them as long as their logos and information are listed and they are credited properly? I'll take a first stab at this, and Josh, if there's anything else you want to throw in, feel free. I think with any type of collaboration that you're doing, you just want to make sure that you're giving everybody credit where it's due. So as long as the organization is happy to lend you the documents, you want to ask them then how they want to be credited for that. They may say, no, go ahead, put on your logo in there, or they may want to partner with you then for the event if you're going to use their information. But it's perfectly okay to use that information as long as you've cleared it from them, you understand how it's supposed to be used, and you're giving them the appropriate credit that they've requested they receive. And I would say that that's true not only from the local perspective, it's within the chapter all the way up to, say, the American Heart Association. They have specific guidelines typically on how they want their materials used and in what settings you can use them. So just pay attention to that. And if you're ever wondering what's okay and what's not okay, just remember that's part of what we're here to help you navigate through. All right, our next question is, how do we collaborate with retail pharmacies to get our patient care projects completed?
I think that there's a great opportunity, again, with Walgreens being a supporter of Operation Heart and, again, tying projects with one another. I know that's something that student pharmacists have told me they've had success with in the past, is getting the members of your chapter or of your committee to talk to the pharmacists that they work with. If you have a couple of members of your committee who do work as community pharmacy interns, they already have a connection with the pharmacists that are there. So I think that it's a good route to sort of pursue. And again, maybe it's your new practitioner mentor using their network and seeing who they have, you know, in sort of their back pocket that you can reach out to and see if you can take some time to maybe set up a table or a booth or whatever it might be that you can implement an event for your patient care project.
Yeah, and I think to just add in some words of wisdom, if you're going to a brand new site, just make sure that you know exactly what you're asking when you go in and that you know exactly what you need from that pharmacy. So make sure that you reviewed all that information, go over it with your chapter advisor or have them come with you so that when you're going to make that initial ask that it's very clear exactly what you're doing and that location, whether it's a pharmacy or any different type of setting, knows exactly what it is that you're going to be do there. It'll add to your credibility and really make them want to partner with you more. And that same token, whether it's a new collaboration or an old standing one and you go there every year, make sure that you're utilizing the power of the thank you. I can't stress enough how much people appreciate being told thank you for the work that they're doing, and that's going to help build your relationship and make it a long-term one. I think you can also, if you're looking for where to get started and who to reach out to, you can utilize your experiential sites. Pharmacists there are used to having students around. It may be even something that you can then have your final year members who happen to be there get involved with. Now that being said, you do need to make sure that it's very much understood what's a educational part of their curriculum versus your project. But that is something that you can do too. So working with your experiential office to maybe identify sites that you can go to. That's another good way to kind of get started if you're looking for pharmacy sites to get started in. Our next question, health fairs are a great opportunity to conduct research studies and surveys to analyze the impact that students are having on the community. And we would like to do something like this year. Have chapters previously done studies like this? And do you have any suggestions for getting it started? Josh will take the first stab at this, and then I'll let you weigh in. In previous years, we had a project that did focus on research. We've since phased out that project. But what I would say is that you want to do a lot of planning if you're going to be doing this type of research. And I think part of it depends on whether or not you're going to need IRB approval, so institutional research-based approval, or if you're just doing it to kind of survey if the community is getting the message that you're bringing. And that's actually something that we already do through Generation RX, through a pre-test and a post-test, if you will, for your presentations. So it kind of depends on how you're going to be utilizing that data that you're collecting. So spend some time really sitting down with your chapter advisor and any of your faculty or other pharmacists that are going to be precepting your project to walk through some of those steps and determining what data you're going to collect, what does that mean that you need to get cleared, and how you're going to be utilizing it in the future. But definitely, you know, as the profession, we always want to document and showcase the impact that we're making. So I'd say good luck in getting that done. And you can, if you're interested and things work well, there are opportunities for you to actually showcase your work at the APhA annual meeting through our poster presentation. So that's an option for you too. Josh, anything you'd add in there? Any experience doing research with your projects?
No personal experience, Crystal, but I would absolutely just reiterate what Crystal said. Have it well thought out and well planned, and just be knowledgeable if you do need the IRB approval, that you think about that ahead of time. And again, at APHA's annual meeting exposition, the poster session is a great way for you to showcase some of that if you are able to follow through with the research aspect of that.
All right, and just to clarify about the Walgreens contact information, that contact information will be available soon. We don't have it yet. When we have it, we'll send out email communications to the chapter leaders, chapter advisors, and then we'll most likely be posting that on the Operation Heart section of the website. So that information isn't currently available, but will be soon for you, and we'll definitely send out communication so that you know when it's out and where you can find it. All right, I'm just clicking through to see if there's any questions that we have not answered. So we have a few minutes left. If you haven't gotten in your question, I would definitely type it in. So one of the next questions that we have is, many forms of pharmaceutical health are covered in the intentions of these projects. Are project chairs encouraged to produce health-based education in a non-pharmaceutical light? For example, there is a following for healthy exercise through barefoot running styles at our school. Are students encouraged to find support and educate on oddball topics like this? I think there's two pieces to this question, and if we don't answer it completely, please send in your question, and I'll be happy to follow up with you. So the projects are very much based on showcasing what it is that pharmacists can do in these areas. So through screenings, we don't have specific recommendations when it comes to medications. Now, that being said, it doesn't mean that you can't do brown bag events at your screenings as a part of your health fairs or events. You just need to make sure that you have the appropriate pharmacist and student pharmacist training, and that you're following your state guidelines on what you can do and can't do for those. And the reason that we gear much more towards the disease state is that we want people to understand the things that they can do to prevent getting in those situations. So stopping tobacco use to prevent conditions like COPD and lung cancer. We want to make sure that people are educated and know how to prevent having to take medications. And that allows a lot more opportunity then for you as student pharmacists to get involved. So that's, I think, the first part of your question. And then the second part about these unique activities that are happening. Certainly, I think if it's a question that you've received at your pharmacy, it's probably something that you could then receive at a health fair. So barefoot running is very much a trend right now. It's not something I necessarily know a lot about, but if you think that you're going to get that question, I would say be well prepared for it and do your research on it, and know what kind of things that people need to consider when they're doing that. Certainly it's a heart-healthy activity. If there are any risks in there for stepping on something and getting cut and they need to be able to treat that wound, maybe you take it into that spin and it becomes a part of your operation self-care. But anytime there are those health trends out there, I think a good general rule of thumb is to know about them and be prepared that it might be a question that you get asked. Josh, any thoughts on that topic?
Yeah, I mean, I'm a sucker for being innovative and finding new and unique things that you can push patient care into. So like Crystal said, just be mindful. It might not necessarily fit one of our existing patient care projects, or it might not be something that we could implement nationally, but if it's something that you're interested in, I would say go for it and pursue it. And I think Crystal made a great point in saying maybe there are other ways that you could work it in. Maybe that's something you could suggest as a healthy lifestyle choice, you know, for Operation Heart or Operation Diabetes. And then, again, just to echo what Crystal said, maybe you wind up with a cut on your foot. You know, how do you deal with that? Is it OTC worthy, or do you need to make a referral? So I think there are some cool ways that you could work that in if that's something that you're really interested and passionate about integrating into your patient care projects.
All right, well, we have reached the top of the hour. Before I turn it over to Josh to close, I just want to say If there are any questions that you didn't get answered or things that you've now thought of that you wish you would have asked, then please feel free to email us at apha-asp@aphanet.org. You can go on pharmacists.com and find that contact information as well, but we definitely want to make sure that you are getting your questions answered, and please remember we are always here for you. And Josh has actually got that email address up now on the screen, so send in your questions there. So Josh, I'll turn it over to you to close.
Thank you so much, Crystal. Yeah, guys, absolutely. If there's anything that you would like to share with us, if you have any other questions that you didn't think of during this webinar, please feel free to reach out to any number of the contacts that we've gone through, whether it's the first email address listed there, myself or Sarah, whether you need a high-resolution logo and you're looking for that, or anything, anything about patient care. Please feel free to contact us and reach out to us. We'd love to hear from you. I'd like to thank all of you guys for attending and listening to what we had to say tonight. Remember, this webinar has been recorded, so if you want to get your hands on it after this point, it will be posted on our YouTube channel. And lastly, just good luck with your projects this year. I know you guys are going to do an awesome job, and I'm excited to see what you guys come up with.